My name is Professor David Bartlett and I work at King's College London Dental Institute, and today I'm going to show you how to use the BWE tool to examine your patients for acid erosion. The BWE tool is an effective and quick assessment of your patient for acid erosion. It can be done as part of your routine dental care, and it only takes 2 to 3 minutes to look at the teeth and to assess them and then grade them. The BWE tool uses 4 scales: 0 for no wear, 1 for wear which is just some changes to the enamel surface, 2 surface wear which is less than 50% damage, and 3 which is greater than 50%. It's an effective, it's quick tool, it can be done within a few minutes and can be part of your routine examination for your patients. Okay, so we're now going to do a BWE score. We're going to look at the mouth and we're going to look in each quadrant. We're looking at the top left hand quadrant, the facial, occlusal and lingual surfaces. The upper anterior quadrant, facial, occlusal, incisal and lingual or palatal surfaces. The upper right side, the occlusal, the buccal and the palatal surfaces. On the lower left, molars, the bicuspids, on the facial, occlusal, incisal, the lower anterior teeth, facial, incisal and palatal or lingual, and the same in the lower jaw. We score the tooth with the greatest wear in one quadrant. In this case, Sarah's got no wear virtually, so in the upper left quadrant she would score 0. The upper anterior quadrant, on the upper 1, there's a slight amount of acid erosion on the buccal surface, would be a 1, and the upper right side would be a 0. 0 for the lower left quadrant, 0 for the lower anterior quadrant, and 0 for the lower right quadrant. If we look at the upper right central incisor, we're going to look at the facial surface, the incisal occlusal surface, and the palatal surface. We score 0 to 3, 0 being no wear, 1 being early enamel loss, 2 being less than 50% of the surface, and 3 being greater. This upper central incisor, we've lost the mamelons, they've disappeared. We've lost some of the surface characteristics, and that's probably a level 1. And close together, Sarah, that's fantastic. So we look at this tooth in the lower molar, and we can see the rim of enamel exposed, 2 yellow spots of dentine. This is greater than 50%, and therefore the acid erosion is scored level 3. So we look at this photograph of the lingual or palatal surfaces of the upper incisors. We can see dentines exposed on all the surfaces of all the teeth. So we choose the tooth with the greatest amount of acid erosion, which in this case they're all the same, and it's level 3. On this bicuspid, there's a very slight amount of acid erosion on the occlusal surface, on the buccal area or the facial area, slightly more on the palatal surface, but it's still less than 50% and it's level 2. So we're looking at a photograph of the upper teeth, looking at the facial surface in this case, and we can see there's some slight loss of detail. The mamelons have been worn along the incisal edge. This shows early sign of acid erosion and it's level 1. So we're looking at both central incisors. We're looking at the whole of the facial surface of both of these teeth. We're looking at the incisal translucency in the mesial area and distally. We see there's total loss of surface detail. We can see almost a rim of enamel being exposed. This is level 3.